This video is a basic primer video on diabetes. I'll explain how it happens, but also answer very common questions that I'm asked, and patients always come to their doctors trying to figure out what they should or shouldn't be doing, especially with all the TV ads for different drugs for diabetes. Well, what is diabetes? In a normal, healthy person, the pancreas, which is an organ inside the abdomen, produces insulin. When people eat food, there's sugar that's in that food, or carbohydrates. Those carbohydrates get absorbed, that goes to the liver processes it and stores some of that in what's called glycogen, and some of that gets released to the bloodstream. Insulin sticks to glucose in the bloodstream, and when you exercise, pulls that into the muscle so you have reserves for exercise, and the glycogen stores can get released. More insulin gets released when it happens, it goes into muscle, and that gets used for exercise. So how do people develop diabetes? Well, type 1 diabetes, where somebody's born with diabetes, or you can develop type 1 diabetes as an adult if the pancreas fails. But type 1 diabetes means your pancreas just can't make enough insulin. And when the pancreas either at birth doesn't make any insulin or too little insulin, then there's not enough insulin to stick to the glucose in the bloodstream. So your blood sugar levels are very high. And that's when people need to inject themselves with insulin to bring the blood sugars down. That happens frequently enough, but with the explosion of obesity, not just here in the United States, but worldwide, and even countries like China is facing a very large problem with obesity, and their population is much greater, so their population of diabetics 5 to 10 years from now is going to far exceed what we see here in the United States. The explosion of obesity has led to a big increase in what's called type 2 diabetes. Type 2 diabetes, the problem is fat cells take insulin out of the bloodstream without glucose. So as people gain weight and they add more fat cells, those fat cells take insulin out of the bloodstream. If you measure someone's insulin levels even before they're diabetic, their insulin levels are higher, which means that your pancreas is producing more insulin than what would normally happen in a regular person. We have a little smart car, which is a 2-seater car that has a very small engine. We can take the engine out of the car and put it in an Escalade, and it'll drive the Escalade, but the engine's going to burn out much faster trying to pull an Escalade than it would be trying to pull a smart car. The same issue happens with diabetes in the pancreas. So for a period of time, the pancreas can produce more insulin, produce more insulin, and produce more insulin. Well, after years of producing too much insulin, at some point the pancreas says, I can't keep up anymore. And then even though the insulin production may still be 2 or 3-fold greater than a regular person, once that starts coming down, there's not enough insulin in that patient's bloodstream to stick to the blood sugar, and then the blood sugar goes up. So once people have elevated blood sugars because of obesity, the process actually happened years before when the pancreas was on overdrive for that longer period of time and eventually started burning out. During this process, before someone's blood sugars are exceedingly high, physicians should be recommending better diet and more exercise, but most importantly getting weight down. And weight is simply calories in, calories out. So when we talk about diet as a cardiologist, we may talk about low salt diets for patients that have high blood pressure that retain fluid from congestive heart failure. We may talk about a low saturated fat diet for patients that have high cholesterol. Once someone's a diabetic, they need to be very careful with the carbohydrates that they eat. But before someone's diabetic, if they're overweight, being overweight is essentially calories in, calories out. You can't create or delete mass. If you take in more calories than you burn off, your weight goes up. If you burn off more calories than you take in, your weight goes down. Those calories can come from a Twix bar, it can come from 100 grams of broccoli, but a calorie is a calorie. It's the same regardless of the source. Losing weight, it's much easier to take in fewer calories than it is to burn off the calories. A Twix bar may be 100 calories, I can eat that in 10 seconds. 100 calories is also 10 minutes on a treadmill to burn off that same Twix bar that I just ate. So I could either do the 10 minutes or not eat the Twix bar, and I'll be calorie neutral. Or I can add 10 minutes of exercise, burn an extra 100 calories a day, and not eat the Twix bar or drink the soda, whatever I'm taking the excess calories from, weight's gradually going to go down. So during that process, before someone's blood sugars are high enough to the point that they need medications, the treatment, both to prevent patients from becoming diabetic and to cure patients from being diabetic, if they already are diabetic and the pancreas hasn't completely burnt out, is exercise and diet to get weight down. From a weight standpoint, I said it's easier to lose weight taking fewer calories and burning it off. From a diabetes standpoint, when you exercise, you burn some of that glucose in your bloodstream. So it's better to burn off the glucose, both to help the diabetes and the weight, than it is to take in fewer calories. In reality, doing both is going to be the most helpful all around. If someone's weight is too high and they get their weight down to normal range and the pancreas hasn't burnt out, then those patients can be cured of their diabetes. It's not just a treatment. They cured themselves, or if they weren't diabetic yet, they prevented themselves from becoming diabetic. Going back to the analogy of the smart engine and the Escalade, if you run the Escalade for 6 months or a year, but you put that engine back in the smart car is going to probably run fine. If you leave that engine in the Escalade until that engine burnt out, and then you put it back in the smart car, it's not going to run the Escalade and it's not going to run the smart car. And the pancreas is the same thing. Once patients burn out the pancreas, it doesn't matter how much weight you lose, you're always going to be dependent on medications to keep your blood sugars controlled. If you can get the weight down early enough, and this is why prevention is key, if you can get the weight down early enough in the course of diabetes or pre-diabetes or borderline diabetes, that's the best thing to do because you still have a functioning pancreas. The problem with diabetes, even in patients that have pre-diabetes, is it significantly increases the risk of heart disease, which is why myself as a cardiologist is talking about this. The other problem with diabetes is it does not only affect the heart. Diabetes affects almost every organ in the body. It affects the eyes and is one of the most common causes of blindness. It affects the kidneys and is now becoming one of the most, if it is not already the most common cause of patients ending up on dialysis. How we treat the diabetes, other than encouraging patients to get exercise and diet, there's a slew of medications, both pills and injections. Ozempic initially came out as a drug just for diabetes, and in the early studies for diabetes, it worked very well at controlling diabetes. What they noticed is not only did it control diabetes very well, but those patients lost a good amount of weight. They subsequently did studies on patients that were overweight to see how well it worked for weight loss, and the drug worked very well for weight loss. That led to the social media, California, Hollywood stars taking Ozempic just to lose 5 pounds, and a shortage of the drug because people are taking it just for weight, even though they probably don't need to take the drug. But despite all of this, the company said, we're realizing that in a diabetic group and an obese group, these people are having much fewer heart attacks. And there was a study that was done specifically looking at Ozempic and heart disease, and there's significant reductions, even in the non-diabetic group, in patients who take the drug that have coronary artery disease and preventing the risk of a subsequent heart attack. There is a pill version of Ozempic, which is called Rybelsus. Rybelsus does work. It helps for heart disease and for control of blood sugars and for weight, but the benefits of Rybelsus are far less than the benefits of Ozempic. It is a pill and it's not an injection. The injection is only once a week. It's not 3 times a day. And the needle is a very tiny needle. It's essentially the size of a mosquito nose. So even though patients are afraid of needles for the most part, this is one of the easiest things to inject. And there's other drugs within the same class that work very well. There's a newer drug, which is also advertised on TV, called Mounjaro. Mounjaro seems to have better weight loss than Ozempic, but there's not as much data, since it's a newer drug, that it helps to prevent coronary disease as much as Ozempic does. Unfortunately, especially for patients that are over 65 and on Medicare, Medicare does not see obesity as a disease. So unless someone is diabetic, Medicare will not cover. Even if patients have supplemental insurance, a lot of the supplemental insurances don't cover these drugs for the patients that we want. And they're not cheap drugs. They're expensive drugs, or patients will be spending thousands usually each month for the drug if their insurance doesn't cover it. Because of that, many insurers require patients to take older drugs. There is a drug called metformin, which many patients with diabetes take in addition to other drugs. And once someone has diabetes, often they're on 2 or 3 drugs. Metformin works very well, and there is data that it helps prevent heart disease. Most insurances want patients to either be on metformin or fail metformin before adding a second or a third agent for diabetes. Metformin does work very well, The newer agents, however, have more data in preventing heart disease and are more effective both for weight loss and A1C. A separate class of drugs are called SGLT2s, and this is a different drug where essentially you urinate out more glucose. SGLT2s have very good data at also improving heart function, more so in a patient with what's called congestive heart failure, or patients that build up fluid. And I have separate videos that talk about congestive heart failure, just like I have separate videos that talk about coronary artery disease. The SGLT2s have very good data, though, that it improves mortality, meaning you're more likely to be alive if you take the drug than don't take the drug. And a lot of that benefit isn't just from an endocrine benefit, meaning a diabetes pancreas, but it's from a cardiac side. There are some studies now looking at a combination of GLPs, which is what Ozempic is, and SGLT2s together. And the combination of those two classes of drugs may be the best initial combination for patients that are overweight, have coronary disease or heart failure, and diabetes. We need more data before those will be the first and second line drugs that we give everybody with diabetes, but the data thus far looks promising. The next argument is going to be fighting with insurance companies to get them to accept this as first in line therapy so that patients can afford to take the drugs. I hope you enjoyed this video. I will post a second video explaining a little more about diabetes. I hope you have a good day.